Hello, I'm Dr. Murray Susser. I can be reached in West LA at 310-479-8909. And I'm here to talk to you for a few minutes about the TACT study on chelation therapy. TACT is T for trial, A for assess, trial to assess chelation therapy. Chelation means metal binding, and it is used in conventional medicine to take toxic metals like lead and mercury out of the body. In vascular disease now we can say it's used to improve the healing of vascular disease. That means diseases that cause heart attacks, and although this study doesn't address strokes, it probably does a good job in decreasing the risk and the incidence of stroke, as well as the incidence of heart attacks or other cardiac events. In the study, 17% reduction in cardiac events, that would be things like heart attacks, in the people who got 30 chelation therapies. The chelation is an intravenous therapy, and it takes several hours, and it is done in a series of treatments. And there were, I believe, 1,700 and some people in this study, and 17% of them, and there was a 17% decrease in cardiac events in the people who got the treatment. Now, in subgroups, the diabetics had an even better response. Diabetics who had got chelated in this study had a 39% reduction in cardiac events. The cardiac community, by and large so far, has been lukewarm or even pejorative, in the way they address the results of this study. They say it isn't strong enough, it isn't enough information, it's too soon. And remember, though, that these condemnations are coming generally from doctors who have been condemning chelation for 30 years. I've been involved with ACAM, American College for Advancement in Medicine, who were major players in this study, because most of the doctors who worked in the study were from ACAM. I was one of the founders of ACAM back in the 70s, we in those days we were fighting losing our license or being put in jail for using chelation therapy. And there are a number of doctors who have been severely attacked by medical boards and various organizations for using chelation therapy. Now, this study justifies, to a large extent, maybe completely, the work that we've been doing over these years. There are now hundreds of thousands of patients who have been chelated and have done very well, and have had very, very low toxicity. For all the hundreds of thousands, there's probably over 1 million people who have been chelated in this country by doctors in a very quiet way, because you don't want to jump up and say, hey, I'm chelating. And if you get out and advertise that you're a chelating doctor, at least up to now, before this study, you could be severely punished. Nobody had come out and approved the drug EDTA, the drug ethylene diamine tetraacetic acid, which is a synthetic amino acid, right? And therefore it is a drug, and it was patented drug at one time. It's out of patent now, but it is a pharmaceutical drug that requires a prescription for use. But nobody. But the EDTA is not under patent, so it can't make a lot of money. It's inexpensive to make, and if this were a drug now that some big pharmaceutical company owned a patent on, with this kind of study, this drug would be a multi-billion-dollar drug more than likely. As it is now, it's several generic companies can make it, and you can even have it compounded by a compounded pharmacy. So the chelation is available now. I wouldn't be surprised if certain powers in the world tried to stifle it and make it illegal in one way or another, make it difficult for it to be produced. That's the strategy that we've generally seen in the medical when the medical world in general doesn't want something to be used. But here's something that has shown to be extremely safe. EDTA is an anticoagulant. It's an antioxidant, and it chelates toxic metals and takes them out the kidney. When it does that, it decreases the risk of heart attack, which we can now say because this study, the TACT study, shows that that's what's happened. That's what's been going on. I've been using chelation since the early days. I was among the small group who did chelation when it was maybe 30 of us in the country who were doing it, and it was scary because there was so much controversy and so much anger about it. But the lovely thing about it, the thing that kept us going, is how well the patients did. The patients who were scheduled for bypass surgery or amputation of a limb, they often got completely better without heavy medical treatment and without surgery. So that was the motivation. That was what spurred us on to continue to do what we're doing, because we knew what we were doing worked. One of the things you could say about chelation is the doctors who gave chelation to their patients, to a doctor, to every single doctor I knew, and I knew hundreds of doctors doing chelation on their patients, everyone also gave chelation to themselves and their family. I chelated my mother, who had a terrible skin condition, and curiously enough got better with that. She also had arthritis, and she had heart disease, and she lived to be 93, and I think she would have lived a lot longer had she not been one of the few people who I saw develop an allergy to EDTA. I couldn't give her EDTA anymore, and she started going downhill after that. She had a really severe allergic reaction. But I've only seen about a half dozen people out of the thousands that I've seen get chelated. So the idea of doing chelation and having people get better when they were given these gloomy prognosis. One of my favorite stories, I tell this quickly, was I had a patient who had 3 heart attacks, and he was getting a treadmill test every 6 months. He went back to his cardiologist every 6 months, and he had a treadmill test, and he flunked it very quickly. He got chest pain, had to get off the treadmill. That went on for about 3.5 years. He heard about me, and he came to get chelated, and he asked about chelation, and he was certainly a candidate for chelation, and I had him chelated, and he had 30 treatments, and he went back to his cardiologist, and the cardiologist put him on the treadmill, and he hadn't mentioned the chelation, but the cardiologist put the patient on the treadmill, who promptly passed his treadmill for the first time in 3.5 years. And the cardiologist said, "Well, what we're doing is finally starting to work." The patient said, "Well, I went to see this guy Susser, and he did this chelation on me. He got 30 chelations." That's not it. That's what the doctor said anyway. I disagree. I think and now this study, the TACT study, gives me support and reason to have scientific backing for what I say. Up to now, it's been mostly personal experience, although there have been a lot of lesser studies, lesser than the TACT study, which was a $30 million government-paid study. But there are a lot of lesser studies which showed evidence that chelation did work for vascular disease. Anyway, it's nice. It'll be nice to bring this treatment into the mainstream armamentarium of treatment for heart disease and other vascular conditions. Thank you.